In this edition of Expresso Time, we'll be looking at the co-pilot. I know AI isn't there yet and I'm working on it, but until then you're stuck with me, I'm afraid. So it's just an interesting case that got sent in. What would you do? So with that, let's dive in. Okay, let's have a look at this case then. So you've mentioned possibility of extractions or a twin block. So let's just go through the photo. So certainly an increased lower face height, possibly some mentalis activity. Okay, reduced overbite, that would fit with the increased vertical dimension. So yeah, definitely a high angle, a clockwise growth rotation. Okay, he's got a short nose, shall we say, stubby nose, but I'll be a bit mindful of doing extractions on a profile like that because it's going to flatten him a bit more. Okay, so we've got some chunky centrals, slightly triangular, so I dare say some IPR might be needed. Again, we've got the increased sort of the vertical dimension with the decreased overbite. Slight crossbite tendency, so just make sure there's no displacements between centric occlusion and centric relation. That crossbite will just come out in the wash using your fixed appliances with your arch wires. Okay, doesn't look a quarter unit 2 there. Okay, looks reasonable there. Like I say, get rid of these, get some more ortho elongated ones. So probably invert my lateral brackets because I want some more buccal root torque, but just mild crowding. And like I say, we've mentioned about IPR just because of the length-width ratios and possible triangles developing, which would help relieve the crowding. The lower, yep, you could just procline them to relieve the crowding. Maybe a bit of IPR if needed. Okay, this is where we really want to have a look at the scans. So okay, 1, 2, 3, 4, so mild to moderate crowding. Reduced overbite, like we've said. Okay, so this is a far better reflection of what this matches the skeletal pattern class 2, and now that is some chunky overjet. Could use a functional. Problem with a functional in a high angle clockwise growth rotation is that you get eruption of the molars, so you're actually increasing the vertical dimension. Okay, you can put spurs on if you're super keen. We used to use high pull headgear. Neither of that is a practice builder. Could take out the upper 4s, get your canines class 1, but like we've mentioned with that profile, don't really want to be retracting these too much. And again, these are quite retroclined, so that would fit with a functional. Functional would reduce the overjet. But just look at the gingival margins. Again, we've seen that. Invert the laterals. Let's find a good picture. If we look at the occlusal plane, which is also mirrored in the gingival margins, usually we get this step when we have a deep bite. He hasn't got a deep bite, he's got reduced overbite. So I would suggest he's at the limit of his dento-alveolar compensation for his vertical discrepancy. As we can see, this sort of curve of Spey in the lower. Now, where's the other one? I know if you just trundle along and put your fixed appliance on, The relief of crowding, the proclination, is going to reduce the overbite. And we're also going to intrude these. Okay, you will get a bit of posterior extrusion as well, but the forces of mastication will pretty much keep these where they are. So if these intrude, because the slot goes to the wire, you're going to create quite a big anterior open bite. Again, there's hacks around it. You could sort of open the bite, put the arch wire in, so prop open the 7s, and then these would extrude, because extrusion's a lot easier than intrusion, and then re-intrude the 7. But again, you're going to increase the vertical, the mandible goes down and back, you're going to make it more class 2 and much more vertical. So I don't think a twin block is ideal. I don't think just ploughing on with fixed appliances is ideal. Certainly these high angle cases have sort of weaker muscles, so like the Koreans, we don't want to use heavy class 2 because you will extrude the molars. Increase the vertical, mandible goes down and back, more class 2, more overjet. Now, you know where I'm going because I've mentioned the Koreans. We looked at the lowers and we noticed the curve of Spey. We do notice on the upper, look at the gingival margins. So what's happened is the upper posterior have erupted to try and keep the teeth in occlusion. And that's why you've got this uneven gingival margin, which we can see here. Where's the front shot? Okay. So if you did want to treat him with some dento-alveolar compensation, we need to use skeletal anchorage, Koreans, mini screws, that's where I learnt them, to intrude the upper buccal segments, which will allow the mandible to auto-rotate up and forward, which would help reduce the overjet. And when you put your fixed appliance on, like we said, slot goes to wire, stainless steel wire, that'll be flat. So you'd intrude, you'd flatten, this would rotate up and forward. Now, I'm more than happy to do a VTO, visual treatment objectives, on your lateral KEF, predictive tracing, that's fine. But this is a very difficult case, and it's only looking at the little nuances. Ideally, I would get a KEF because it could be a surgical case, but like we say, mini screws certainly broaden the envelope of dento-alveolar compensation. You still need bone to move the teeth in, you can't grow that. But you might get an acceptable result, and you could illustrate that with a KEF using the mini screws if they decline surgery. So, yeah, you did right questioning this one, because if you just carried on, I think you might have got your fingers burnt with quite a big anterior open bite developing, quite flared forwards. So yeah, did right, and yeah, wait for the next case you send. Okay, cheers.